Hello, my name's Dr. Bennett. I'm a board-certified orthopedic surgeon working with Central Indiana Orthopedics. I've been in practice 26 years, and my specialty, I do general orthopedics, but also kind of specialize in hips and knees. One of the hot topics these days, and everybody's talking about, and it's all over social media and internet, is regenerative medicine and stem cell therapy. And if you would ask me about stem cell therapy 2 years ago, I would have said it's voodoo, because I really didn't know anything about it. I went to a meeting at about that time, and it was a national meeting, and at the meeting there was a lecture that was going to be given by a plastic surgeon from Hollywood, California. And I thought this ought to be really good, and actually it was really good. And it sparked my interest in regenerative medicine. And what regenerative medicine is basically the body healing itself, repairing cells that have died different ways. And so it's always been somewhat of an interest, but for 26 years I've used metal and plastic and surgery to take care of the problems. So this is kind of an interesting topic. I went to several meetings and started doing stem cell therapy. The stem cell therapy, as you look around the internet, can mean many different things. There's a lot of hype about it, there's a lot of question, misinformation, and so I started looking into it, and the group that I'm hooked up with is the Cell Surgical Network out of California. And what they do, and what we feel right now, the best stem cell therapy is basically from adipose tissue. So the basic question, I guess, is what is a stem cell? A stem cell is basically your healing cells. They're in our body, they're dormant, they're single cells that can develop into many different types of tissues. There are a couple different types of stem cells that we talk about mainly. Everyone hears about embryonic stem cells, and that's the fetal cells that are in the very basic development, the 2 or 4 stage process that can develop into any structures. Embryonic stem cells cannot be utilized for treatment in the United States. So the other type of treatment that we talk about, the other type of cells, are adult stem cells. And the adult stem cells are throughout our body in many different locations. We have some in our bloodstream. We have those also in the bone marrow. And with the bone marrow, these adult stem cells, another area that can be found is recently, in the past several years, they found they're noted in adipose tissue, our fat tissue. And most of us have enough that we want to be donors for this type of procedure. But in the fat cells, in the adipose tissue, they're finding approximately 500 to 1,000 times higher concentration of the valuable stem cells compared to the equal amount in bone marrow. The bone marrow stem cells that are obtained is more of a painful procedure that we're actually taking a needle, putting it inside the pelvis bone, and aspirating the stem cells. They are also finding that the stem cell concentration in the bone marrow decreases over time. So as we age, there's less and less stem cells in the bone marrow. So the place they found is our adipose tissue. In the adipose tissue, it's easily accessible under a local liposuction procedure. We do this in the office under sterile technique, and we harvest less than 2 ounces of adipose tissue under a local anesthetic. You're wide awake, talking to us as we do this procedure. It takes approximately 15 minutes or so to obtain the 2 ounces, the 50 cc's of cells, and then we have you leave for a couple hours while we process them. After we process them, meaning we centrifuge them and end up with about 10 cc's, 2 teaspoons of a slurry That slurry is called SVF, stromal vascular fraction. And in that SVF are the healing stem cells, but also growth factors and other healing tissue that then we take that and we can inject it into areas of damage and areas of needing repair. The stem cells are being used, and the cell surgical network are all under IRB protocols. So these are all research protocols that are being done under the investigation. So this is an investigational process. This isn't approved by the FDA. None of these procedures are approved by the FDA. They do not approve a procedure. They approve medications and they approve prostheses, those type of things. They do not approve a procedure. So this process, then we take those cells and we will inject it into knees, hips, shoulders, and since I'm an orthopedic surgeon, that's what I'm strictly treating. But the cell surgical network has many IRBs, the research protocols that they're doing for neurologic problems like Parkinson's, ALS, they're using for strokes, for heart attacks, many different things that they're investigating now. I am strictly doing it for musculoskeletal problems because that's my expertise. When I started looking at this, I didn't look at stem cells as the end result, the only treatment, but as an orthopedic surgeon, I'm using it as an adjunct or another tool that I can use for treating patients. So when a patient comes in and they talk to me about knee pain, we don't talk about stem cells right away. We talk about, what's your knee pain? What happened? Was there an injury? We go through the stepwise approach. And say they have arthritis. Say it's a person that has some mild arthritis or knee pain. We talk about, can you use just medications? Can you use injections of possibly a corticosteroid injection? Or do you need surgery? Or would stem cell therapy be something that maybe could keep you out of surgery or be an adjunct to surgery? So we deal with the whole patient. We're just not promoting stem cells or promoting one type of treatment. The main thing with a patient when they come in and they're asking and they tell me they have joint pain, we have to figure out what the reason is. We need a diagnosis. And that's the reason I think an orthopedic surgeon like myself can treat the whole patient. Not every person is a candidate for stem cell therapy. What we need to do is discuss the problem and go through the options to see if you are a stem cell candidate. Maybe something just like anti-inflammatory medications, an Advil or a Aleve or something like that will work. Great. We try the lesser things first. And also we will get patients at times that are, for instance, with arthritis. I've treated patients now that are elderly patients, or maybe they are not the ideal candidate for a total joint replacement, like a total knee replacement. So what can we do trying to give them some relief? We've treated patients like that to try to get them some relief, to try to keep them out of a surgery like a knee replacement, which is a big deal. So not every patient is a candidate, and what we do is we go through the process to see what is going to be the best treatment for you. When we look at the ideal patient for stem cell therapy, the ideal patient is the patient with pain or with some minor injuries, not necessarily the patient that has the advanced arthritis, but I think the ideal patient would be one that has lesser arthritis or mild problems. So potentially stem cell, regenerative medicine, repair type thing can work before it gets to the end stage, before it gets to the bone on bone, where at that time, maybe the only treatment is total knee or total hip replacement. What we can tell you though is out of the 10,000 plus patients that are in the data banks, we know that 83% of patients that were treated for knees, 83% have said they're improved. That means on a pain scale of 1 to 10, before we start the procedure, we have you fill out a questionnaire. Maybe your knee pain at rest is a 5. Well, 83% of patients total have said they're improved. So that means maybe their pain went from a 5 to a 4 or a 5 to a 1. Different patients do differently. With shoulder patients, it's approximately 80% overall that are improved. Hips are about the same thing. So it is an alternative to possibly surgery. But there are many patients that come into the office that I tell them, you are not a candidate because you have too advanced disease. It is a waste of your time and your money for that situation. But it is definitely the options. My job as an orthopedic surgeon is to give you the options. And then you decide with me what's going to be their best treatment. I've been with Central Indiana Orthopedics for approximately 17 years now. I was in practice in Ohio 10 years before that. I came to Central Indiana Orthopedics because it's my hometown, but also because of the quality of care and the group of 40 practitioners that we now have that are highly skilled providers in orthopedic musculoskeletal care. That's what we do. When I see a patient for knee pain, again, I don't concentrate on that they need stem cells. I concentrate on what is the best treatment for their problem. All of our providers do that. We do not feel that we're going to treat a patient out of our scope of practice. We treat musculoskeletal problems, and we're all caring professionals that work up the patient and do what we feel, and I feel, is best for the patient in working relationship with the patient that they can make their own decisions. So when we're doing our stem cell procedures, as I mentioned, there are several different ways to obtain stem cells. The approach that we're taking is using the adipose tissue, your own fat. These are your own tissues, live tissues, your own DNA, so there's no chance of rejection. I feel strongly that that's the best approach at this time. There are others around that are injecting amniotic fluid, frozen placenta, that is approved by the FDA, but we do not know whose DNA this is, and we do not know the long-term results. And yes, it is good for anti-inflammatory properties, but there are no live cells in those tissues. If I'm going to be doing a procedure on you, I want to utilize your cells so there's no chance of rejection and they're live cells. For further information concerning your joint pain and stem cell therapy, you can call our office at Central Indiana Orthopedics, or you can go to our website, ciocenter.com, and with that website, there is a section on regenerative medicine. I'd be glad to talk to you, work through your problems, and see what we can do to make you feel better.